and welcome to the CannBlessed Nurse podcast. This is Denise Chesne, and I am here with a master's degree in nursing to interpret the science behind cannabis and help you to make informed choices for your optimal health. After many inquiries from patients, friends, and family regarding the use of cannabis, I delved into the emerging body of knowledge on the endocannabinoid system and the use of cannabis as a therapeutic option. Today, our focus will be on PTSD, or Posttraumatic Stress Disorder, and how CBD use can alleviate many of the symptoms associated with this condition. PTSD is a chronic psychological condition that can develop after experiencing a traumatic event. It does not occur only in veterans. Anyone who has been involved in a terrifying event can experience PTSD. In fact, people often don't believe they meet the criteria or even have the right to have PTSD because it is regularly associated with first responders and military veterans. But here are some examples of traumatic events that may result in PTSD. This list is not complete, but should give you an idea of victims who may fall prey to this disorder. Victims of domestic violence or abuse. Witnessing someone being killed or seriously injured. Surviving a car, train, or plane crash or accident. Surviving a heart attack or receiving a serious medical diagnosis. Being a victim of rape or sexual assault. Being a victim of crime, kidnapping, stalking, or torture. Experiencing a life-changing event, such as divorce, unemployment, or the death of a loved one. Experiencing a natural disaster like bushfires, earthquakes, floods, hurricanes. And, of course, experiencing a war or civil conflict or terrorist attack. Traumas such as these affect the nervous system. Our nervous system is a complex system that involves nerves and cells, which are known as neurons, which transmit signals from the brain to various parts of the body. When the brain experiences any event that has negative consequences from a stressful or dangerous situation, the hormone adrenaline kicks in via the sympathetic nervous system. This is commonly known as fight or flight, which is a natural built-in stress response. However, in PTSD, the stress response is heightened, and instead of returning to normal soon after the threat is over, it is pushed beyond its limits and becomes stuck. The nervous system loses its ability to self-regulate, leading to psychological and physical distress and frequently PTSD. Post-traumatic stress disorder can manifest in many ways. According to the Anxiety and Depression Association of America, the following are commonly associated symptoms of PTSD. Experiencing vivid and distressing flashbacks of the trauma. Physical symptoms such as a racing heartbeat, sweating, even brain fog. Having trouble sleeping. Being overly emotional with mood alterations such as rage, shame, blame, negativity. Emotional detachment. Negative beliefs and feelings. Intrusive thoughts and memories. Anxiety and hypervigilance. Living in fear. Insomnia, nightmares, and strange dreams. Difficulty maintaining employment. Difficulty concentrating and focusing. Avoidance and social isolation, and substance abuse. Specialists explain that PTSD symptoms, as well as their severity, vary from person to person and that it can take months or even years for them to appear. People living with PTSD often experience multiple symptoms as the body and mind